Sarah here with Insomnia Mom. Today I am here with Dr. Amy Robinson, physical therapist with Restore Your Core Physical Therapy. So Amy, thank you for being with us today.
Thank you for having me.
Tell me a little bit about what you do here at Restore Your Core Physical Therapy.
Sure. So at Restore Your Core Physical Therapy, we are a specialty pelvic physical therapy clinic. We treat adults, teens, and tweens, and we treat really for just about anything that you can think of. We are physical therapists first and foremost, so we treat all orthopedic conditions, but we specialize in all the pelvic conditions such as urinary incontinence, pelvic pain, constipation, diarrhea, sexual dysfunction. For teens, a lot of times we'll see teens for period-related pain. We also see women for that as well. Sometimes it just gets swept under the rug and women think that they have to live with extreme period-related pain. Big ones are endometriosis and PCOS. We can help with those things along with primary and secondary infertility. A lot of people don't realize that physical therapy, pelvic physical therapy in particular, can help with infertility so long as you have that specialized training. So if you want to come in for an initial appointment, and initially you would call one of our front office managers, and they have a set of screening questions that I have set up for them to ask, and that just actually tells us how many appointments roughly we think we need to schedule out. And so it allows us to know how many things that they have in their history that might be impacting that initial thing they called in about. Say they called in about leaking, but really when they ask the screening questions, there's like 6 other things that they didn't realize could be linked. And so then we set up either a 90-minute or a 60-minute initial consultation, and that is one-on-one with a doctor of physical therapy who specializes 100% of their day in pelvic health. I set this practice up as a cash practice because it gives us the ability to be able to look at the whole body. We are not restricted by anything insurance is telling us we can or cannot do, and a lot of times that's just what's lacking. A lot of times clients have been in an insurance-driven network, and so they're limited. Those providers are limited by what they can look at. It's usually certain body parts per session, and so here we get to look at the whole person. So we're not just looking at the pelvic floor here. We are looking at what is the root cause driving the dysfunction.